Hey friends, Jeff here with a new episode of Conversations Life Science Leaders Aren't Having. Today we welcome to the show Brian Culley. Brian is the CEO of Lineage Therapeutics, where they are true leaders in developing cell transplant medicine. Brian's been a CEO for over 20 years. That's remarkable for him as a young man, and this journey has been transformative for how he sees the world, how he sees himself, how he sees his relationship to investors, to employees, to the patient, and how he balances all of that is one of the things that we dive into in this conversation. As I've gotten to know Brian, who he is to me is the word stewardship. And we bring that word into our conversation today. Brian sees himself as a steward of the responsibility that he's been gifted with to develop life-changing therapies and drugs. He sees himself as a steward of the resources within the organization and making the ultimate best use of them. Brian is stewardship. I think you're really going to enjoy this conversation with Brian Culley. Brian Culley, welcome to the show, Conversations Life Science Leaders Aren't Having. Thrilled to have you.
It's my pleasure. Thanks so much.
You're welcome. You just heard me do a brief introduction of you and who you are to me. It would be great, Brian, if you could just start us off and let us know what you're up to in the world.
Yeah, well, I'm keeping very busy running a growing biotech company focused on cell therapy and cell transplants. Love it to death. It's based out here in Southern California, where I've lived for a long time. And we are trying to expand a new branch of medicine, and really enjoying that process.
This strikes me when you said it almost just rolled off your tongue, and I love it. Most of the people we talk to, and my clients included in that, they do at their heart, they love it, but that's not always the first word that they say. What is it about it that you love?
So I've always been reasonably passionate about science. I think science is just a really cool discipline, and being able to function or serve in that discipline, and finding a place or a way professionally where I can enjoy my work, and have that scientific backdrop of developing new therapies, developing new medicines. It just feels very rewarding. I feel some people call it a calling. I don't know if I'd go that far. It's just that I happen to be intrigued and interested in the process of developing new therapies, and through some luck and some good decisions along the way, I've been able to make an entire career out of doing something that hopefully is going to change one little corner of medicine.
Was there a moment when you realized in maybe as a really young person, maybe high school, college, or even beyond, was there can you think of that moment when you're like, I can do this. They actually will pay me to do this as a career. Was there a moment?
Yeah, so there wasn't. Like, I've got friends who had pediatric cancer and became passionately committed about becoming doctors and things like that. For me, there was tension, actually, right? You just because you love something doesn't always mean that there's a career, or at least the career that you imagine for yourself, available. And so my journey into the job that I do now as CEO of small companies, that actually happened quite late. So I used to work in the lab. I was doing research. I was okay at it. I wasn't great, and I had an opportunity, kind of early mid-career, to transition to the business side of biotech, and that was the convergence of some skills that I feel that I have, but with the backdrop of scientific discovery, and putting those two things together really kind of clicked for me. I was like, yeah, this is what I want to be doing. So I came through fields like technology licensing for a university, through business development, buying and selling drug rights, and then ultimately to become a CEO. And so there really has been I'd like to say a convergence of the scientific and the business side in my career. And that's where I think, it's the highest and best use of, what Brian Culley is able to do.
Yeah. Yeah. And as I was looking at your profile, CEO in that role since 2010. So we're 23 years, and you had a small gap in there, but 23 years as chief executive officer. And one of the things we like to ask here on the show is from a quote by John Ruskin that says that the highest reward for a person's toil is not what they get, but what they become. So if you think about the last 23 years as in this role as CEO, who has Brian Culley become?
Well, you can't help but grow over a period that long. So I think I've become better in a lot of different areas. But what I'm trying to become is a chapter in the history of product development and new medicine development. So I've always had this particular feeling that um, success for me I've been saying this for many years, would be to leave the world a better place than I found it, right? If you can do that as a human being with your brief time here, that feels to me like success. So the way I'm trying to accomplish that is through the process of drug development. So, for example, if our lead program for one of the leading causes of vision loss, if that becomes a product and people are able to see better and benefit from that, potentially I could help millions of people have a much higher quality of life. That's extraordinary. So I really think the journey of becoming is just getting better and better at, hopefully having that kind of experience. And that was something that was said to me many, many years ago by a guy who was a consultant to a company that I was a junior member of the team. And he said, Brian, I was involved in the development of a heart failure product. And by the time I'm dead, I'm probably going to help 15 million people live many more years. And I thought, wow, like that, I get it. So that's what I want to do. That's who I want to become. I might be forgotten. It's okay for me to be forgotten, but along the way, I want to be an important contributor to making something happen that improves healthcare, improves quality of life for people, many, many people, and really feel like my time here on the planet was well spent.
Mm. I'm going to ask you a hard question because we're not mind readers of those closest to us or to you. What do you imagine those that you are closest with and to? What have they observed? What would you imagine that they've observed in who you've become over in your journey?
Wow. So I think there's been a lot of growth. Much of that comes organically through your experiences, right? You could have a human resource issue or, an ethical challenge, and you grow and you learn. And I think I've gotten better at looking beyond sort of the four corners of myself and thinking more about the impact on others. It was an important lesson that I learned from a good friend who himself is a CEO now, but he used to work for me, and he was someone who I asked when we had to, unfortunately, do a lot of layoffs one time. And he said, listen, Brian, you're going to speak to a large number of people, but they are all only thinking about what you're saying and how it affects them.
Mhm.
And that kind of connection, understand when you're speaking to someone, they're really thinking about what you're saying and how it impacts them. And I think that is something you can get better at. So I've really tried to go beyond the almost stereotypical, like rising up in your career, better titles, better parking spots, better offices, and better pay, right? And really think more broadly about organizations and teams and how we can all rise up and have it be, less about the individual, which was great when I was, 30, and more about the output, which is far more rewarding and satisfying, being over 50 now.
Hmm. I had this insight recently working with a client, and they happen to be in ophthalmic space, and And what we realized is that their ethos was we changed lives. But I'm thinking about it as I reflect on what you're saying. They're very clear on restoring vision and improving people's vision. So the patient is important, but they also had this idea that, to your point about, your employees, that they're in a position to change the lives of the people who work for them. So that's their ethos, is on both perspectives, changing lives for the patient that they're serving, but also changing lives. They had a real clarity that they're in a position to change the lives of the people that work for them. And I just have this sense that, whether that's an ethos or a specific thought that you've had, that's part of your growth, is you have both. It seems like you have both in mind.
Yeah, I think that, human beings, I think this is probably a protective trait, but we're terrible at really multiplying out to large numbers from small effects. And what I'm specifically thinking about is, if I skim the news and there's an earthquake somewhere in some part of the world, and 800 people die, I skim past that headline. And in contrast, if my a daughter falls off her bicycle and comes in crying, right, I'm moved, I'm feeling a lot of empathy, and I want to make sure I take care of her. And so there's but when you think about those two and contrast those two events, like the impact of 800 people and all the people that know those people and everything, compared to a kid who scratched her knee, um, we tend as human beings to lose sight of that. And so I really like the idea of taking people along this journey, right? I feel really driven and motivated to try to find new medicine. That's, again, my particular way of having an impact. And if I can take not only the staff on that journey, but shareholders on that journey, caretakers for the people who we treat on that journey, the nurses, the doctors, they might not even be asking or looking for going on that journey. That might not be their personal driver. But if in hindsight, they get to be part of that chapter in history where they've made the world a better place, I don't think any of them is going to regret that they were along for that journey. So that's really motivating, and it's fun to think about the multiplication of the impact that you can have in that way.
Yeah, I love that. Love that picture. Without them even being knowing it, they get to step into this exponential impact that's possible by what a few people are doing on the front end of that. It's really powerful. So let's cast the name of the show, and which is Life Science, or Conversations Life Science Leaders Aren't Having. When you hear me say that phrase, what's the first thing that comes to mind?
Um, Gosh, I don't know. I've always been a public company CEO, and so I spend a lot of time, in that world, and thinking about the investment community and Wall Street and everything that goes along with it. Um, and I think it's fascinating because in some ways it's inextricably linked with science and biotech, and in other ways it's so distant. And I think that the conversations that people need to have, I think sometimes there's areas of that are surprising. So like, yeah, I think about sometimes a shareholder will invest in a company, and then it goes down 5% and they're mad, and immediately you'll start saying all these bad things about a company, on social media and everything. And I'm always stunned by that. It's so self-destructive. It's such strange behavior. And I think as a CEO, you're responsible for many things. Yes, you're responsible for product development, but ultimately your job is to create value. And there are many ways that you do that, and you have to pay attention to all aspects of it. And I think sometimes there's I think folks may overlook the many diverse areas of the business you have to work on. And I think that how markets work and our ability to predict how markets are going to behave and what it means to a company and the capital cycles and everything, it's extremely, extremely difficult. And I don't know that it really gets talked about that much. There's a lot of focus on the data and the fundamentals. There's so many other factors that go into a company's journey from, let's say, startup to a multi-billion-dollar acquisition, that sometimes it's either taken for granted or it's overlooked, even though it might be just as impactful.
Hmm. So Obviously, in a public situation, you're not going to necessarily have the opportunity to speak to every investor. But if you could gather them in a room and no cameras, no recording devices, and just have a heart to heart with them, what would you say to them? What is the message that you would want to convey, or maybe it's a reciprocal conversation? What would be in that conversation?
That's a great question. It's funny. I almost the first words that come to my mind are, "We know," right? So like people might be critical. They'll be like, "Oh, this is taking a long time." Yeah, we know. We're trying. There are reasons, and sometimes we can share those reasons, and we do, and sometimes we cannot. Maybe there's a competitive reason where I'm prohibited from sharing it. Like, but we're aware of what's going on, and if you've built a good organization, you have a lot of people who share your vision, share your urgency, who know it's imperative, and who work very hard. And it's never satisfying, right? The investment community, you go from $5 to $500, and they'll still say, well, it should be 2,000, right? So there's an insatiable appetite for more that's out there. And not everyone has got the thick skin, I think, to be able to handle that. But I would say it would be so wonderful to be able to bring people behind the scenes so that they could see the intellectual cleverness and the hard work that goes on behind the scenes. And, you can't really convey that on a daily basis to people, and especially if you've got thousands or tens of thousands of shareholders. But yeah, we know we're all trying to get what you also want out of this interaction, which is success.
Yeah. And how do you balance it all? Because you said your goal is to deliver value to these investors, these shareholders. You talked before about making a generational impact, healthcare wise or science wise. You have your employees that are a part of this equation. How do you balance all of that in operating the business and how you communicate? It feels like almost I don't want to call it a fool's errand, but really challenging.
Yeah, yeah. Well, I mean, it actually comes back to the theme of the show. So what I mean by that is that there's a question that I think never gets talked about, which is, um, okay, yes, I have a fiduciary duty to my shareholders. Great. But which shareholders? Because they all have different needs.
Yeah.
So, a founder who might be the largest shareholder, you go, oh, but you really got to hold that person's, interest as a priority. Yeah, but what if that founder got involved 20 years ago and has kind of lost touch with the, current competitive landscape or something, right? You could have a disconnect,
Yeah.
even though that might be the largest founder. So, who are you working for? The shareholder just bought most recently, the shareholder put the most money to work, but people have different targets. One person wants to get 20% in the next month, and another person wants 20x in the next 5 years. Those are really different decisions to serve those disparate objectives. So it really is difficult, because you have to kind of pull all of that together. And at some point, at the end of the day, you need the ability to go home and be like, I'm doing the right thing here. I'm doing the best I can. It might be a little bit of sacrifice for this person, a little bit of sacrifice for that person, but I'm taking the organization in the right direction, generally with a long-term view, because the day-to-day vacillations of share price are not what is critical. I mean, sometimes they can come into play, and there's very specific scenarios where that happens. But generally speaking, you're talking about trying to develop durable value. And that doesn't happen quarter to quarter, like you're selling widgets. That has to happen because there's an expectation of revenues from products that's getting used because it's the best possible product and it makes a big difference and it gets reimbursed. So you have to take that long view, but at the end of the day, you still can only do what gets funded. So if
Yeah.
you don't also serve the short-term interests, you're going to run out of money and you'll never reach your long-term goal. So you do have to balance it, and that's part of the job. And that's what we're hired in part to do, is be able to make the best possible decisions with the information we have, in light of the uncertainty and the unknowns and the unexpected macro factors that could affect your business. And of course, sometimes compounds don't work, and sometimes, fortunately, they do. And, we all are just really trying to take our backgrounds and experiences and judgment to make the best possible decisions. And every once in a while, there's a world record type event that really drives a company to new heights.
Mm, mm. And in this journey of calibration, adjusting, I sense from both you and our other guests, this is a constant. It's a constant thing. It's not okay once a quarter or mid-year. It's constant. And I'm wondering, what are your questions? So what are the questions that you regularly go to help the organization calibrate or recalibrate?
I often think about what I get per dollar spent.
Mm,
I really try to challenge the team to think about things in the same way, right? So, we're not going to develop a product candidate just because we own it. We want to be really smart about where it sits in the milieu of assets that are out there, and what's the highest and best use. What are we trying to do? Are we trying to partner it? Are we trying to retain it? How you approach your developmental strategy could differ. And they're personal, you didn't ask this, but there are personal conflicts that can come into play, right? A CEO who is very influential on their company and happens to have $100 million of personal net worth might have a very different risk profile than a CEO who has mortgaged his or her house in order to, fund their startup, right? The two risk profiles and what they're looking for could be very different. And that means how they look to develop the product and how they instruct and organize with the team to develop the product could be very different. That also never gets talked about, right? So you see people, it's like, oh, the CEO bought stock or the CEO sold stock. And it's like, oh, I must know. Well, maybe the CEO's kid is going off to college, or, maybe, but we don't often have the same predictive power of our own share prices. So yeah, it can be very difficult. At times it can be very lonely. I mean, it's, you are responsible. And even when you make what you believe in your heart of hearts to be the very best decisions for the company, and incorporating and sort of organizing all of those disparate factors and saying, all right, we're going to do X instead of Y. Sometimes you're wrong, and sometimes it's your fault that you're wrong. Sometimes you're just unlucky. But it can be very difficult. And so really all we can do, I think, all of us who are authorities of our business, whether you're CEO or you have some other kind of line authority, or you're sitting on the board for a company, to the extent that you're influential in an organization, you really are just trying to synthesize a lot of unknowns and try to make your decisions from that. And sometimes it's obvious, right? So if you do the work, sometimes the right decision rises up and it's quite clear. Other times it's a coin flip, and coin flips suck because because you can't control it, and we all want to. We all believe that we're smart and we can be analytical, and we want to think that we can rationalize our way to success. But there are a lot of things that we cannot control, but we still have to be responsive to those.
mm. There's so many questions that come up for me as I'm listening to you, Brian. A word that you haven't said, but really I hear it in everything you've been talking about, is stewardship. Like that there is a deep feeling that you have, and I'm sure others do too, but in this conversation, I'm just sensing this deep commitment to being a good steward of the dollars you have, of the resources you have, of the responsibility you have with a particular drug or molecule or whatever asset we're talking about. Yeah, stewardship. Does that word resonate? Is that the right word, or is it a different one?
I think it's an excellent word. I don't have a prepackaged vocabulary for this conversation. This is a really different conversation, right? I don't usually have these kinds of discussions, and even internally. And so I do. My gut instinct is that stewardship's a great term with the right people, because if you don't view it that way, right? If you start to think of it as your own capital, or if you start to think of it in a possessive way of the business, you can be very connected without feeling possessive about your business. But if you realize that you're tasked with, you're given this privilege, this responsibility to work on something, and everyone's rooting for you, right? Maybe your competitors aren't, but everyone else is rooting for you. And in that sort of framework, you're responsible for that money. You're responsible for that money that the shareholders have provided in exchange for the shares that you've granted them. And you have to do the best possible thing with that capital. And that stewardship is both a legal and I feel sort of just professional obligation you have. And it's interesting because it can run into conflict. And I described some of this before. You can run into situations where you're sort of scratching your head and you're thinking, is this the right thing? Am I really putting patients first? You hear patient first all the time, but do people really put patients first? Sometimes you can't. There's another conversation that people don't have. Sometimes you might actually be putting share price first, and patients have to sit off to the side for a minute because you're trying to bridge to something else, and then you'll be able to pick back up. And I mean, that's an honest conversation. If anyone says that they do patient first, 100% of the time, I don't know how you can truly be successful because, again, that is only one component to building a business. And you have to accept the realities of those other pieces, even though sometimes those pieces can be conflicting or really negative. But you really are thinking about the destination, right? No, no, no. Everybody has the picture of themselves holding the marathon medal at the finish. They don't show pictures of mile 8 because mile 8's really boring. There's nothing happening out there. But you had to go through mile 8 to get to mile 26.
Yeah. Yeah. And you're formerly a long distance runner, which is maybe to the outside view an individual sport, an individual endeavor. You acknowledged even your CEO-ship is often is lonely. How do you extend your view to see the bigger picture when it does feel it's just me, I'm alone? How do you do that where I'm actually not alone. I'm part of a team.
Mm.
How does that happen?
Yeah, I rarely viewed my long distance running pursuits, which were pretty extensive and pretty serious for the many years that I was engaged in that. I rarely felt that I was alone, right? I was often a member of a team that was trying to win a team competition, right? Cross country racing, right? All through college and high school, it's all team sport, even though it's individual suffering in the moment. So I never felt that alone. Even if I were out racing, I felt some kind of duty to, even to myself, but to others as well. All those times I spent training, right? I was sacrificing something. And so doing well, performing well was partly paying off in a way of saying thanks for letting me go do this. And so I do think that long distance running on its face is a very individual, lonely pursuit, but it contextualizes professionally very easily for me because I always kind of integrated a team component. And maybe it's just support. Maybe it's just a person traveling to a race with you that weekend and holding the water bottle for you. I feel that maybe it's guilt of wanting to do a good job for that person as well. So I found it to be very powerful. But there is a component to it for sure that is individual and lonely. And when you're out there suffering, you can slow down a little bit. No one will know. That'll be your little dirty secret that nobody knows that you slowed down for that mile. And finding the reason to not slow down is part of the toughness and the grit that I think made me a pretty decent long distance runner.
And what would you say with that career? Let's call it a career in running. How is that? How is that? Those lessons? How do they apply to your leadership at whether it be Lineage or your prior companies?
Well, long distance running by its definition, it's a great analogy for building a business. Very few businesses are built, overnight and can be instantly successful. You have to go through a lot of ups and downs, and even if it's just a 5K or a mile, on TV watching it, you just say, oh, that guy's in front and that guy's in the back, and race is over. It's not very interesting. But when you're in the moment, when you're actually experiencing the nuanced changes in pace and the strategy and the tactics of a race, it's a very complex, and I think that does have analogy to the experience of trying to build an organization. Sometimes things are really easy and you just go with the flow and those miles fly by. And other times, it's sleepless and stressful, and those are, analogous to the difficult times in a race where someone's trying to pull away and you're trying to figure out if you can hang on to them or you're redlining. So I think that both the team component as well as the individual component have been very beneficial for me professionally.
I'm a adaptive athlete, and so I've become that later in life. And there's self-talk, and what I've realized is some of the self-talk when I'm out there doing my thing is some of the same self-talk that I use when I'm sitting here or I'm in front of a client. I'm wondering if there's self-talk that you remember saying to yourself, coaching yourself on the course, or maybe even now. I know you've transitioned into playing soccer. Is there self-talk as an athlete that you find yourself saying almost the exact same things to yourself as CEO?
Well, there's growth. I don't know. I mean, the self I was a strange athlete because I actually was, well, actually, you know what? As I think so, as I start to say this, maybe there is. So I was actually driven by skepticism and doubt, right? So people who thought, oh, you won't be able to do this, because I was not, born on a treadmill. I mean, I had to create myself into a decent long distance runner. I was not, gifted in any particular way. Maybe I had the right body type, but I was forged out there on the roads more than, just dropped on this planet as a cheetah. So I I still have that, right? Like when people like, oh, your company's not good or you're not good or whatever. I do find motivation from that skepticism. I do like to disprove people. I find it as an incentive that I can tap into, including on bad days. Because I am working very hard at what I'm doing, and whether that was running or whether that's my job, like there are times when people say critical, you're not very good, but I always have the opportunity to disprove them. So I do think I'm surprised. I was going to say that no, I don't find that self-talk, but actually there are some pieces that I do think when you kind of back up really far into sort of the core and the psyche of what incentivizes a person, what motivates a person, I do think I find some overlapping there, some overlapping areas there.
Yeah, my current one is I just recently did a obstacle course race, and I was up against a pretty challenging obstacle, and I'm in a wheelchair. So and they, the team I was with said, you don't have to do this. You can go around. And I said I didn't. I had to drive 11 miles or 11 hours to get to this race. I said I didn't drive 11 hours to not do this. And I have found that I say a version of that when I'm afraid in the moment to make a tough call, to do a hard thing. I didn't, it's not 11 hours, it's whatever the journey has been, but I found myself saying that to myself more than I had expected. So that's why it was just, I've been thinking about that. And that question came up of that self-talk of the motivation of how you just pull yourself through difficulty.
Hmm. Hmm.
What what's the conversation, because we've talked a lot about your internal game, so to speak, of how you approach your stewardship, the how you approach the work that you're doing. How do you translate your own journey and what you've learned to your team?
Uh, well, I only want to do that partially, right? So one of the very first, I remember this was my first day of my MBA. this exercise, and there were like 25 tasks, and we were told to organize the tasks in order. And he very quickly came to realize that the tasks were very hard to organize because some of them were antecedent to others, but then it was really hard to kind of say I would do A, then B, then C, then D, all the way down through the alphabet. And half the class was tasked with this as a team, little groups of four, and the rest were done individually. And of course, the teams just absolutely kicked butt. They did a much better job. So, although I do like my ideas, I try not to try not to create a culture of imposition where it's like everyone is just executing on Brian's ideas, because I would be leaving a lot of value on the table, right? We hire people who are skilled and have great ideas, and I want to make sure I extract them. And one of the important lessons I learned, fortunately, early is, the difference between the extrovert and the introvert. And, the introvert might be sitting there with absolutely much better ideas. And if you don't ask, you're not going to get them. So I have tried to grow professionally to say, yeah, okay, once we have a plan, you got to be on board with the plan. You can't be contrarian for the sake of contrarian. That can be disruptive. But I do want to hear your ideas. I like when people say, "Oh, I was thinking about this, and here's what we could do." So, I I do want to share, because I have this perch as CEO, that I see a lot of different moving factors. So someone comes to me and says, "Oh, I want to do this $1 million animal study." Well, we can't, and here's why right now, but maybe we can do it later. I need to bring them in and share that so that they're part of that conversation, have my more comprehensive awareness and the synergy of all the different moving pieces that I'm trying to consider. But at the same time, I'm not just going to like send an email and be like, "Not approved, end of story," right? Ask me next week. That's not productive. So I want to kind of broaden the capabilities of the team, offer my ways of doing things, and also receive those back. And it's an imperfect process. It's hard to measure. It's imperfect because you have so many different types of individuals that you work with. Your lawyers and your chemists are very different people. So it can be challenging, but I think if you're doing it well and you've got good organizational behavior, you're trying to reach that efficient frontier as a business and operating with a lot of fluidity and performance. And you can feel it when it's really clicking, when the oars are in the water. You really know it's happening.
Mm. And how about those more cultural, or the tone that you're setting? Like this word stewardship, not a word that, as you acknowledge, that you might have used in the past, but at the spirit of that is how you show up and what you want to create at Lineage. How do you cascade that so that everybody is thinking, again, not necessarily that word, but that the spirit of that word of stewardship? How do you cascade that in your leadership throughout the organization?
Yeah, it was an early lesson, and it was a hard learned lesson, that everyone's watching the CEO. Is what somebody once said to me. And I learned it because someone said something. I rolled my eyes, and I found out afterwards that all 8 or 9 people around the table saw that, and they all took it away. And so that was an early junior and immature move by me, and I hadn't appreciated at the time that all eyes were on me. Everyone's looking for information, feeding back to that. What does it mean for me? When Brian says this or Brian does that, what does it mean for me and my job and my career, my work? And so it's really important that you're setting the tone at the top. People are going to follow you, they're going to monitor, they're going to make sense of it, and they won't forget. If you do something wrong, they're going to remember for years. So you have to have an inclusive and diverse organization. Those are my personal beliefs, and the organization needs to believe that as well and live that as well. And that's where you're getting the most out of your organization. So, I think it's important for CEOs to keep in mind that people are watching them, even when you don't think that they are. They are looking for clues and cues as to how they're going to be affected by your thinking. And so, you have one bad day, you could set off a whole, chain of negativity in your organization just because you made one offhanded comment because you were frustrated, and you recovered 5 minutes later, but your company didn't. So it's careful. You have to really be careful. The lights are always on and people are always looking, and you need to perform accordingly.
Yeah. One CEO, he said to me, "I learned that I can lose credibility in an instant because people will know very quickly if I'm being authentic to the values and the culture that I've said are important, or if it really is not that important. Like you said, a facial expression, a sideways word, um, or lack of expression, all of it. But people will sometimes misinterpret. But his message to me was, I can lose my credibility in almost an instant.
I think that's wise, and it's true. And how you treat people, right? You have an exiting employee, or you've got a troublesome employee. How you treat that person, everyone's going to think, well, is that how I'll be treated? So you have to really think all these factors through, and it's sometimes difficult, and it's not what we all want to do, right? It's always worrisome when human resources shows up at your office door. You're always thinking, this was not on my calendar for today, right? I was gonna look at that rat data, or I was gonna, talk to this potential partner, and but that's part of the job. You just take it up and do the best you can with it.
Yeah. Brian, this has been just such a insightful conversation for me. I'd like us to end with one question, and I'm going to give you the magic wand, and you get to wave it over every CEO's office, life science CEO across the globe. And with that wave, you get to plant the seed for one conversation that they're going to have over the next week. What's that conversation or question that you're going to plant in their minds and hearts to have over the next 7 to 10 days?
Who are you working for? There's a lot of capital out there. There's a lot of companies out there. Um, and many of them are doing, doing great work. Not all of them are doing great work. Some of them are an anchor on our industry, right? There's always some bad apples. So I think all of us need to kind of ask ourselves, what are we working for? There's a small personal part to this. I worked at a company where we had an unsuccessful phase 3 clinical trial. I probably could have stayed at that broken company for a long time, collected a lot of paychecks, and and just kind of not had to work too hard, and figure out what my next move would be. Instead, I worked incredibly hard, and we performed a reverse merger in less than 3 months. We had announced an intent to merge, and so I offered some salvation, some rescue for the shareholders. It wasn't perfect, but it was pretty good under the circumstances, and I was working basically to get myself fired. And so that was easier for me. I was younger. I wanted to demonstrate that I was worthy of a second chance earlier in my career, but that's not everywhere. So I think we always have to be reminded why it helps you get through the bad days, right? To be reminded who you're working for, and going and talking with patients, talking with potential patients, and just being close to the condition, the disease. I think it's very motivating. So, that's the touchstone that I use, and I think a lot of people could benefit from it as well.
It's a great question. Thanks for that. If folks want to know more about you or connect with you or learn about Lineage, where can we send them?
Well, Lineage Cell Therapeutics is online. I have a Twitter CEO_Culley, and I'm kind of active on social, and I really love engaging with people, and this has been a lot of fun. I've really enjoyed it, Jeff.
Yeah, it's been a pleasure. Thanks so much for your time, Brian.